Assalamualaikum and good morning everyone. I'm Dr. Azma Saad. I'll be teaching you on types of drug therapy. Okay. So the lecture outline is that we will discuss on the goal of drug administration, and following that we will discuss on drug actions in the form of the effects of drug therapy. So what is drug? A drug is any chemical you take that affects the way your body works. It can be natural or synthetic substance which affect living bodies, function or structure, used in the diagnosis, mitigation, treatment or prevention of a disease or relief of discomfort, also called legal drug or medicine. A legal or medicinal drug such as amphetamines, however, can be harmful and addictive if misused. So this is a pharmacokinetic drug taken orally. I think this effect can be seen in the lectures under Dr. Siti Khatijah and Dr. Haniza and also Dr. Niza. They'll be explaining more on this graph, and this is basically the pharmacokinetic of the drug. And this is the example of an intravenous route of administration of drugs, whereby similarly as the previous graph shows a graph plasma concentration against the time after last dose. And you can see how different the distribution phase and the distribution phase previously in the oral route. Okay. Alright, so this is just a graph to depict back what you have learned before. So drug actions is classified based on its therapeutic effect. It can be either curative, can be palliative or symptomatic, it can be prophylactic or preventive, and it can be also as known as adjuvant therapy. So what is curative therapy? It is administration of drug with the intention to cure the disease. And medication is able to relieve illness and improves injury. Once we have diagnosed with a disease or condition, we hope to return to 100% of our health. So the goal requires a cure or total healing. That is called a curative treatment. Okay, works is in the region of individual care. So examples of curative therapy. This is usually curative therapy is especially for causes of the disease which is already known. Examples: antibiotics are drugs that can kill bacteria and kill any form of infection caused by bacteria. Antifungal medicines are drugs that can kill fungal infection that causes fungal infection in any area of the body. Antihistamines is actually a drug which acts on the histamine receptor and which helps clear up a reaction to an allergen, which can be a form of curative therapy. It can help to cure the allergic reaction. An antipyretic, as the term implies, is actually for reducing fever. It can reduce fever in patients with viral fever. And patients with a mild viral fever can help to reduce the fever or pain, and that can be curative. However, unlike COVID is dangerous. COVID is a very virulent virus that can kill, and antipyretic will not be a form of curative therapy for COVID-19. It can be more of a palliative or symptomatic treatment. And analgesics as pain relief, especially from, let's say, after you play football or you play futsal, you have a body ache, then you take that analgesics, it will relieve the pain of your body aches. Yeah, so that can be a curative therapy. So it is a definitive care and outcome. So what is palliative therapy? Palliative therapy can also be known as symptomatic care. It is actually a relieving or soothing the symptoms of a disease or disorder without affecting a cure. It is just giving relief. Okay, remember that. and it focuses on relieving and preventing the suffering of patients, occurs at all stages of a disease. And who do you think give palliative therapy? In short, actually many people can give palliative therapy. The physicians, the nurses, the dietitians, the pharmacists, social workers, psychologists, massage therapists, and other allied health personnel. We work together to reach the same objective, which is to relieve the symptoms of the patient. So the goal is actually to improve the quality of life for both the patient and family. So palliative care may be offered by hospitals, home care agencies, cancer centers, and long-term care facilities. Examples of palliative therapy includes reduction of pain in stiff neck due to ruptured disc or slip disc, what we call that, whereby the cause of the slip disc is actually rupture of the intervertebral disc of the spine. So when you just give a massage for a stiff neck or an analgesics to administer, you are just giving a pain reliever which does not give a cure. It only helps to alleviate the pain, okay, but it does not cure the spinal defect. Remember this. And pain management in cancer therapy is actually only to relieve the pain caused by cancer. And chemotherapy is to manage the tumor and prolonging life expectancy. And this is the term usually used in amongst cancer patients. And HIV/AIDS patients which have no cure, we can only give symptomatic relief whenever they have a certain infection on and off. Okay, and asthmatic patients who has asthma, you can give nebulizer to relieve the shortness of breath due to asthma, but you do not treat the cure. It's not a cure. Okay, because when given nebulizer, the patient can get another asthmatic attack, even following nebulizer, because it only affords a relief to the patient, that's all. So we've spoken about curative therapy, palliative therapy. Now we go on to what is prophylactic therapy. It is a preventive measure, a medication or a treatment designed and used to prevent a disease from occurring, guarding from or preventing the spread or occurrence of disease or infection. And it can be divided into primary prophylaxis to prevent the development of a disease, or a secondary prophylaxis whereby the disease has already developed and the patient is protected against worsening of the process. So examples of prophylactic therapy includes immunization, where many vaccines are prophylactic. And vaccines such as polio vaccine, smallpox vaccine, measles vaccine, mumps vaccine, and others have greatly reduced many childhood disease. And human papillomavirus vaccines prevent certain cancers, especially cervical cancers. That is similarly with influenza vaccine. So birth control methods are used to prevent unwanted pregnancy. Condoms, for instance, are sometimes referred to as prophylactics because of their use to prevent pregnancy as well as the transmission of sexually transmitted infections. Daily and moderate physical exercise in various forms can be called prophylactic because it can maintain or improve one's health. So cycling for transport appears to be very significant, improve health by reducing risk of heart disease, various cancers, musculoskeletal diseases, and overall mortality. And for example, drugs, aspirin, which is an antiplatelet drug, it prevents thrombosis in myocardial infarction, whereby preventing another possible attack of heart attack or myocardial infarction. Okay, that's another name for heart attack. So it prevents the possible recurrence of the heart attack. So this aspirin is a form of prophylactic therapy. Adjuvant therapy, also known as adjunct therapy, add-on therapy, and adjuvant care, is therapy that is given in addition to the primary or initial therapy to maximize its effectiveness. So adjuvant therapy is an addition designed to help reach the ultimate goal. So adjuvant therapy for cancer usually refers to surgery followed by chemotherapy or radiotherapy to help decrease the risk of the cancer recurring. So neoadjuvant therapy, in contrast to adjuvant therapy, it is given before the main treatment. For example, systemic therapy for breast cancer that is given before removal of a breast is considered neoadjuvant chemotherapy. And the most common reason for neoadjuvant therapy for cancer is to reduce the size of the tumor so as to facilitate more effective surgery. Okay, I think that ends our part 1. I'll continue on with part 2 following this video. Okay, bye. Till then, see you. Take care and stay safe.